Hi, I'm Rusty Jenkins from Wasatch Physical Therapy in Layton. I wanted to talk to you a little bit about sciatic pain today and how dry needling can help with that. A lot of people think that they actually have sciatic pain when they actually don't. The term sciatica or sciatic pain is kind of a garbage can description of pain that goes from your low back and down the back of your leg all the way down to your foot. What I want to talk to you today about is some ways that we can try and distinguish between a lumbosacral radiculopathy and gluteal referral pain from a trigger point. So they actually did a study in 2015 on people that have lumbosacral radiculopathy, and they found that in almost 77% of those patients that were diagnosed with that, they had trigger points in their glutes, whereas compared to healthy subjects, they had 2%. So some of the muscles that we treat with dry needling are your gluteus minimus muscle and your piriformis muscle. And as you can see, the X's are the trigger points and the colors are where that muscle will refer pain. So down into your buttock, and then down into your hamstring to your calf, and it can actually go all the way down into your foot. And so what we want to do is with the dry needling is to determine how much of that is actually coming from your lumbosacral spine and how much of that is coming from the muscles in your glutes or in your hip, which can cause that pain. So with that, on our subject, what I would do is I would find those muscles, and as I palpate the muscles and whether or not that pain is consistent with the patient's pain, I would be able to determine if that's a good spot to hit with the needles or not. So what we'll do is we'll prep this patient. We'll hit some of these muscles to show you what the dry needling is all about and what we expect to find with our outcomes. So as I palpate his glute, I'm going to come right up into his minimus or his medius, and I'm going to needle that until I find a good twitch response in that muscle. And then I'm also going to come over and hit his minimus. Like that. With this patient, I would also probably needle his piriformis muscle and probably his maximus, and then hook that up to some stem to help provide some input to those muscles to provide a reset with that. At this point, then I would be able to determine whether or not he's actually getting a lot of his pain from his glutes or if it's coming from his low back. So if anybody has any problems with sciatic pain or pain going down their legs or even into their spine, my recommendation would be to come in and we can evaluate you and see if dry needling is right for you. Again, I'm Rusty Jenkins from Wasatch Physical Therapy, and our goal is to get you back to life.